Welcome back. We are talking about sickle cell disease, and we have a very special guest, Miss Adebola Benjamin. Thank you so much, Ma, for being on the show. And you have a lot of experience to pass across to us about how to handle, how to thrive, how to survive with sickle cell disease at any age, right? And through your support groups, you've been teaching and encouraging young and old people who have sickle cell disease what to do. I think one of the things that I saw you emphasize when I attended was for patients or children, adults, to take plenty of water. Why?
Yes, because for an individual with sickle cell disease, there's a lot of there's frequent letting of water from the body. The body gets out so much, water, and there's always a need to be hydrated. So
hydration kind of improves the blood volume and allows the blood to flow better, right?
The body is made up of up to 85% of water, and if you have to pee like 8 times in a day, you'll discover that you're completely dehydrated. And so because of the dehydration, and to keep up that level of water, for the individual with sickle cell disease needs to drink more water. If the normal person drinks like 4 bottles of water in a day, the individual with sickle cell needs to drink like 8 bottles.
Twice?
Yes, twice.
Twice a month. Wow. Because I know, of course, that they tend to have a lot more toxicity, a lot more breakdown, because of the breakdown of the cells breakdown. And so there's a tendency for the blood volume, for blood not to flow like it should as well. I'm trying to make it less technical, as in plain English as possible. But did you see any difference in yourself or in others when you started taking more water? Any specific examples you can point to?
Exactly. For someone like me, as soon as I wake up in the morning, I drink at least 1 or 2 bottles of water.
Yeah, the 75. The which size? The small
75 cl.
CL bottles. Okay, all right.
It improves my circulation, and it gets my system moving.
Okay.
And I believe that it flushes out the toxins and whatever it is that my body does not need. And I also believe that water helps your organs, because they're so stressed. Because there is one important thing that a lot of people with sickle cell disease do not understand, and it's the blood cycle. It's a natural human thing. A normal human being has a 90-day blood cycle.
That's the lifespan of the red blood cells.
The lifespan of the red blood cells.
90 to 120 days, yes.
Exactly. But for the individual with sickle cell disease, the lifespan of the red blood cell is 25 days to 30 days.
Right.
And so, by the time you're getting to the end of that 30 days, your body is weak, it's tired, your blood level is low, and it's like you have malaria. And a lot of them will go to the hospital. Oh, it's like I'm going to have malaria, it's like this one. Instead of staying at home, eating a lot of fresh foods, drinking a lot of water, and then taking a rest to rebuild those red blood cells that are dying out. Because the old cells will die out and new cells will come up. And once you understand that cycle, anytime you start feeling like that, all you need to do, drink more water, eat more fresh fruits and vegetables. Because I, as a person, have discovered that nutrition plays a very important role in my life.
Oh, fantastic. And we do want to talk about nutrition things, and before we start this this show, this segment, we're talking about some of the foods that you have found out that you eat, you feel better, you feel stronger, and there are other foods that you take that make you feel terrible and make it maybe trigger a crisis. So we do want to talk about that, but I don't want us to get away from the fluid thing, because what would you say would be the single most important point
for an individual with sickle cell disease? It's water.
It is water, exactly.
Water, every day water. Every minute water. It's actually like the first aid, is the middle aid, and it's the last aid.
And there you have it, folks. You need to remember that water all the time.
Exactly.
Have you seen any changes I can share with you, with all the people you've supported? Are there any kids that you've seen who were not taking water like they should, or adults that were taking? And then did you see a change?
Yes.
Any specific examples you can share briefly with us? Anything you can think of?
The Sickle Cell Support Center actually started because of this little boy who is here. His name is called Favor.
Let me see that.
I met him in the church on a Sunday morning. A teacher in the Sunday school was carrying this almost lifeless child with his eyes deeply yellow. And he was groaning and in pains. I took one look at him and said, where is the mother of this child? And we couldn't find the mother, because the mother just dumped him there and ran away.
Wow.
And so we had a clinic in the church, and so the child was taken to the clinic. I followed them. Of course, everybody even thought I was the mother. I said, please just put this boy on a drip immediately. Let's rehydrate him, let his system come alive, and this and they gave him a painkiller and an antibiotic and whatever. And after about 3 hours, said, we have to discharge this child. I said, you can't discharge this child. Well, the church had to close. And this child was badly infected, was sick to the bones. And so he ended up being in the hospital for 9 weeks.
Wow.
9 weeks.
So did you have to take, we might have to round up for this segment, but did you have to take him in? And
yes,
that's why you said
I had to
help out.
I had to take him to the hospital. I had to look for some doctors to help us. And I mean, it's a long story.
Okay, all right. But that's how you started this whole support thing.
That was how this support thing started. And I now discover that a lot of parents don't understand that even just drinking a lot of water will help to move the crisis. Will
reduce the impact and reduce the impact of the crisis.
And would help the system.
All right, folks, our time is up. Auntie D, as I like to call you, thank you so much. You cannot go away now, so we're going to come back and continue this.
You want me to talk about 60 years experience in 20 minutes?
Not enough. I understand that. I hear you, but we can try.
Okay.
People need to hear and know what you're talking about. So we really appreciate your time, and we shall continue. Let's put it that way. Again, folks, thanks for joining us. I'm Dr. David Ajibade with the Brain and Body Foundation. See you next week.